Welcome to a CNBC panel special on health and the impact of COVID-19 on Africa's health systems. Now, just to give you a little bit of context, since the first case of COVID-19 was confirmed on the continent in February of this year, Africa's response, led by the African Centers for Disease Control and Prevention, also known as CDC, has been commendable. Now, governments moved quickly to institute public health measures to curb its spread. However, more is needed to ensure that Africa harnesses the urgency of the moment to reshape more resilient and equitable systems equipped to withstand future threats and protect populations, especially the most vulnerable and marginalized. Now, the conversation today aims at tackling some of these challenges faced and analyzing the impact of the pandemic on Africa's health systems. Now, joining us for this conversation is a distinguished panel led by Professor Joachim Osur, who is the director of the emerging markets at Amref Health Africa, based out of Nairobi, Kenya. We're also joined by Joanitah Nvanungi, who is a co-founder of Drugs Dash out of Kampala, Uganda, and Dr. Patrick Singa, who's the medical director at Babyl Health in Kigali, Rwanda. And thank you for joining us, lady and gentlemen. And I would like to go with the lady first. Joanitah, thank you for making the time. Now, quickly, if you could give us just an analysis, the kind of impact COVID-19 has had on your kind of health business and the health sector in Uganda.
So thank you, Arnold. My name is Joanitah Nvanungi, and I'm the co-founder for Drug Dash. We have a web and mobile application that allows district health officers or law administrative officers to see and understand real-time information on the stock status of health commodities in their health facilities and all the others that they have jurisdiction over. So with COVID-19, we piloted this system in 3 districts in eastern Uganda in 2018 and have been monitoring that for 12 commodities under the family planning division. At the start of this year, with the support of UNFPA and the Ministry of Health, we had to deploy in 2 districts in northern Uganda, Kitgum and Lamu. So obviously, as soon as the country was locked down in March, I think that was towards the end of March, it meant that field activities had to halt for a long time. And even when we had an opportunity to start to travel, because we have to train the health workers, store managers, as well as the district health officers and biostatisticians on the use of the system. It means that, first of all, our work was delayed for a bit, but also I think that it's been a blessing in disguise, because where health technologies might not have been eagerly adopted, COVID-19, because of the lockdowns and curtailing movements and access, as we know it in the world, in literally all sectors, it means that technology has literally been forced on people, but also then it means that it has been embraced much easier. Like scenarios where this is the way to live have been made more of the norm. And so for us, I've found that when we deployed in northern Uganda, because we finally did starting July this year, we had a much better reception and a lot less resistance than we found when we piloted in eastern Uganda. And it's not even because there was no need for a system that allows people to track stock levels. So it's both ways, I guess.
I want to bring Dr. Singa into this conversation. Quite everything stopped movement. There was strict lockdowns in Kigali. What was the impact of the pandemic on your kind of health business?
Thank you very much. During the lockdown, which happened for Rwanda between April and May, we saw in the public health system a decrease in number of people seeking care. We saw a decrease in number attending immunization services, vaccine, antenatal and postnatal care, HIV, non-communicable diseases. On the other hand, because people were confined in their homes and all those diseases, the malaria didn't go away, the NCDs didn't go away, they still needed care. And some of them were seeing the healthcare system as a potential place where they could get contaminated with COVID. They chose to use us. So we saw a huge increase in terms of volumes, actually by more than 100% during that particular time, where a lot of patients were calling us from home. Now, that being said, we also very quickly discovered that we are actually sharing the human resources with the public healthcare system. Though the same doctors working in the public hospitals work on a part-time basis on a telehealth platform, and because they were overly solicited in their own hospitals, we were short of supplies. And very quickly, discussions about how do we quickly start task shifting. You don't need nurses to do triage. Can non-clinical staff, some sort of super community health worker do triage, for instance? You don't need necessarily GPs to do the consultation. Can you use the nurses to do some of the consultation? So we had to learn and adapt very quickly.
Bringing Professor Joachim Osur into the conversation, as Amref, you've had Joanitah, you've had Dr. Patrick Singa. There was an opportunity in there already, but it also shows how stretched health professionals were, going by Dr. Patrick Singa's words. What was the impact for Amref Healthcare and the health sector there in Kenya?
Yeah, so thank you. First, just to say that Amref, we are an NGO and we support governments to provide healthcare. And so the impact that we have seen is not really on Amref work, but on health sector generally in the countries where we work. I think the first thing I would like to talk about is the way governance for health has happened during this time of COVID. Who actually makes decisions on health matters, and are those decisions being beneficial to the country and to the people who seek health services? I think we have had a lot of mixed decision making and health governance in different countries. Rwanda, for example, is very different from Tanzania, very different from Kenya or from South Sudan, and many other countries where we work in. What we've seen is that most decisions are not driven by science. And at a time like this, when we have the pandemic, it is so important to stick to the science in order to save lives. And so when decisions are made which are not backed by evidence, then you fall into problems. And that has happened in almost all countries. For example, on the issue of human resources, we know that COVID is basically being spread in communities. And so what we need are people who can work more at community level to help with controlling the transmission of the disease. But where is most of the money going? Most of the money is going in high-tech, high-level hospitals, and we have left community control with no money. And so the disease is spreading very fast because community management of the disease is not there. We are acting at the level where infection has escalated. Look at the issues around health financing. We have now diverted the money meant for other health services into COVID. COVID is important, yes, but unless we equally provide other health services and fund them, we are going to have more deaths from malaria. We are going to have more deaths from HIV and from pneumonia and malaria and other diseases, diarrhea and so on. So we have to ring fence the money for the health sector that is meant for maternal health, for other services, so that we don't fall off in providing those services because of COVID. And then we need to fundraise for COVID-related services. So I can say a lot, but I think the main thing for me is that Africa needs to contextualize health interventions to our situation, make sure that the decisions we are making are backed by evidence so that we can save people not just from COVID, but from all other diseases that we face in the continent.
Does it mean that COVID-19 has exposed the deficiencies in most of our health systems?
Yes, I think COVID has basically exposed the soft underbelly of the weak health systems in Africa. It has shown how many ICUs we have in the continent, for example. It has shown how we can easily get disrupted all services when a pandemic or an epidemic comes, because we don't have enough health workers, we don't have enough money, we don't have enough health facilities. So you just need a small trigger to tip off this balance, and you end up with a mess. And I think if the vaccine does not come soon, we are yet to see the worst of it. In many countries now, we are seeing health workers going on strike. We are seeing lack of supplies. As you know, even supplies for COVID are missing. We are seeing lack of transparency in the way the sector is run, even when it comes to essential things like PPEs. The money is getting lost. So the whole system is so weak that you just need a small trigger and you fall into massive problems, loss of money, loss of lives.
Joanitah, the professor there talks about exposing of deficiencies of health systems. And this, you deal with some of the most vulnerable populations in the countryside of Uganda. Now, does his observation, does it translate to the situation in some of those health centers?
Thanks, Arnold. I think that the situation that Professor Joachim discusses is really it's not a question of whether it's native to Kenya or Rwanda. It's something we see everywhere. And I have to say that, of course, with media, with a very big media spotlight on COVID-19, it being a health emergency, yes, it has given more people a chance to see what so many other people have known for a long time. So the gaps and deficiencies in the health system, some things like staff, so staffing or healthcare workers, the ratio to patients that they have to serve. So many health systems have been strained in this way because it's a pandemic. But even when there is no pandemic, we've seen issues of social services. So you have infrastructure like power, how people access the main grid. So during our deployment in Lamu and Kidgum, we've been there for about an average of 3 weeks this year. And I can tell you that there wasn't a single day where we had an interrupted power supply for more than 2 hours at a go. And you find that some of those districts, it's just what happens, it's the norm. And so for us, of course, it was very easy with our user experience research to decide that instead of going for systems that sit on a desktop, we shall go for a mobile system for the health centers, because we understand the issues of power supply. And we know that mobile devices can simply be powered with a power bank or, alternative power supply. So there's those issues that are not just because health is a multi-sectoral effort. So you find that if people can't access electricity, if transport is bad, even when hospitals are available, people are not going to be able to access the services that they need to access. And I think that COVID, being a thing that the media has had to focus on, has simply drawn light to those issues. But I can't say that they haven't existed forever, if we're being honest.
Dr. Patrick, bringing you back into the conversation, Joanitah and Professor Joachim are talking about inadequate health centers, lacking the basics of a health center. Now, Rwanda's case seems to differ a little bit, but you also hinted on the issue of capacity building in the health centers. Was that exacerbated by this situation?
Thank you. I think the situation in Africa is overall the same. We saw the same kind of inefficiencies in Rwanda. Yes, indeed, the government of Rwanda has been doing quite well, in my view, in terms of how quickly they reacted, in terms of how quickly they put in place the tracing, the testing. They did well, but still we're seeing some inefficiencies and we need to improve. I can give you a few examples. When you look at the supply chain, because we are so dependent on the likes of China and India for basic medication like paracetamol and ibuprofen, when they went in lockdown mode, there were such shortages. When you look at simple things like the face mask, for quite some time, about 2 months, we were all in short supplies of face masks. And those are things that are not, in my view, that hard to produce locally. We just needed the situation like this to put this in our face and say, you guys, what are you doing? I might give you another example. When you look at the digitalization of the healthcare system, we're still far behind. In a pandemic situation where even a lab test request on a paper becomes a potential risk factor because it can be a vector for transmission, we were still using paper in a lot of health centers. When you look at the importance of having accurate and quality data in a pandemic situation, when you are using paper files in most of the hospitals, how do you get the information from a point A to a point Z, from the bottom to the central level? These are inefficiencies that are to do with the whole healthcare system in Africa, and Rwanda included, and we need to improve.
Dr. Singa, I want to stay with you there, and you raise a good point. Joanitah, also feel free to jump in here after Dr. Singa's remarks. Digitization as a solution is being touted quite a lot, but is it the short-term solution?
Digitalization is the way to go. Are we there yet? No. Some few basic steps need to be in place in terms of infrastructure, in terms of the legal framework. But I also do believe that there are low-hanging fruits. We can start small and grow and learn. If we have learned something at all from this pandemic, at least from a Rwandan perspective, is that we can come up with homegrown solutions. And we reacted very quickly in terms of, we deployed the application to trace people at the point of entry. We deployed the application to trace people who are having lunch in restaurant and tracing them in case a positive case is found. We deployed many applications, many digital solutions, and we just needed we didn't need a pandemic so that this homegrown solution can be fostered. These are things we can do. We can start somewhere, and as the infrastructure falls in place and as the legal framework falls in place, the rest would follow. I think we still have a long way to go in terms of infrastructure. We still have a long way to go in terms of legal framework, particularly when you're talking about hosting of data, where most of our African countries are requesting the data to be hosted locally as opposed to hosting on the cloud. Then you have consideration of security versus cost, quality versus nationalism. We still have a long way to go, but these are conversations that need to happen now.
Thank you,
Joanitah,
Dr. Singa.
You heard the doctor's
Arnold, I don't think the question to be tabled for discussion at this point in time is whether technology and digitization is the magic or silver bullet, but rather I think the discussion should be, like Dr. Singa just said, the hows, working out the knickknacks of how this works out. I think technology, digitization, and eventually digitalization of the world in just about every sector, health inclusive, is an inevitability at this point. We just need to work out with our countries, how do we get how do we get the solutions that exist or the solutions that we need to create into place, and how do we make them work for our context? It's not a question of whether it's a short-term silver bullet, because what you need is sustainable solutions, not specifically what's going to work in the short term. And you do need the short-term remedies, that's for sure, but what you need is sustainable solutions. So when you talk about collection of data so that we can manage epidemics and consequently pandemics much faster, you know that there's not many manual ways to do that, and technology has proven that that can be done in a very efficient way. When you talk about management of data to be able to equitably supply social services to your countrymen and women, technology has proven to do that a lot better than any man and woman could do on paper. So it's a question of how do we get our governments, our private sectors to work quickly enough to get this thing working, to get the systems that we need to working for us.
Yeah, so Joan, I'll throw that question back to you. How do we get the private sector and the government to work hand in hand to create these systems fast enough?
Arnold, I think this is already in operation. Most countries, at least I know in this region, all countries have figured out what we call PPPs, public-private partnerships. Those just have to be strengthened. The technology community, of course, because that's really run mostly by millennials and now the Gen Zs, will keep insisting that the government needs to support local solutions. I think there's a lot of capacity building to do there. We see more local hubs, some of them even being owned by the government, coming up in these countries. I think those systems, even though they're not working efficiently, we need to focus on benefits that we might not even see in our time, but work towards them. I think the trouble is wanting, instant gratification. How do I get recognition for what I'm doing? How do I get my solution to kind of be that silver bullet, as opposed to actually building sustainable solutions that might or might not even work or get the support that they should get in their first or second year, but pushing through that and demonstrating things like proof of concept. Of course, it's unfortunate that we get a lot more support from foreign firms and donor agencies and those kinds of development agencies. But I think the point is to let's get this working. I have no problem with Drug Dash being supported by UK Aid first, and then UNFPA picking it up and the Ministry of Health running with it. What I want is for people who need medicine to have it when they need it, and to have the medicine that they need when they need it, where they need it. At the end of the day, who supports that initiative is not unimportant. It's just we'll get there. I just believe in picking up whatever we can get, we can get it.
Professor Joachim, bringing you back into the conversation, Joanitah talks about how quickly we need to get these systems working. How do you think we can get these systems working quickly enough?
Yeah, thank you. I think we need to continue learning and using the lessons we are learning to improve. And so some countries are doing that, but we are worried that there is fatigue setting in and complacency. So we started on a very high note as Africans. Most countries started very early with lockdowns and so on, but with time, things are falling off and we are no longer using the lessons that we are learning to improve. I think success lies in continuous improvement through evidence-based learning. Being a new disease and bringing a lot of things that we didn't expect in the system, we can only continue learning and implementing as time goes. But also, very urgently, I think, I don't know if there is any country which has sat back to relook their health strategies because things have changed. You can no longer stick to the same strategies that you have been using before COVID. There is urgent need to relook our health strategies at Africa level, at country level, so that we reformat them to match the current circumstances, so that things like immunization falling back or how we task shift to other health workers and all that are taken care of, so that we manage COVID and also manage the other health services. So it is, according to me, all about leadership, better planning. It's all about dedication to the evidence and doing the right thing.
Professor, in your parting remarks, what are the opportunities, and you just have 30 seconds for that, what are the opportunities for Amref from this pandemic?
We have an opportunity, and I think some of my colleagues here have talked about it. We have an opportunity for global solidarity to work together between the private sector, the civil society sector, and the governments to find a solution to this big problem that we have. I think the next phase is about vaccination. And again, private sector is heavy there. We need civil society to mobilize communities, and we need governments to organize us. The more we can work together, the more we will achieve. Thank you.
Dr. Patrick, in your parting remarks, the opportunity?
Well, I think our government need to invest more, but invest in a smarter way. I think our overall budget for health need to be increased, but we also have to give a special focus to our human resources for health. Know where they are, how they're being used, and how happy they are going forward.
Very brief words there. Joanitah, 30 seconds.
Hey, I think this pandemic presents us a very unique opportunity for governments and health ministries, specifically, and organizations, development agencies, to throw health back in the hands of communities. We know very well that regardless how brilliant an initiative, how brilliant the programs that we conjure up are, or even technologies, without community engagement, without the community owning their own health promotion and improvement, things like health education, we can't have sustainable improvements in our health. I think because this pandemic is real, it's many people know someone who has suffered from, suffering with, or has been affected or even died from COVID. It presents us a very unique opportunity to bring health back into the hands of the community with all our planning going forward.
And that was our conversation on the impact of COVID-19 on health systems in the region. As always, I'm Arnold Kwizera. You can tweet us at CNBC Africa or tweet me directly at The Real Kwizera to be part of this conversation. Have a great day.